I think the biggest myth is that skincare has to be complicated. And
Like, where do you see the skincare industry heading? What trends should we be hopping on, know about?
to make sure that we're fueling ourselves properly, you need nutrients for your hair to grow. Your hair is not going to grow if the rest of your body is stressed out. One topic that's super hot in that world is using vaginal estrogen on your skin.
Hi, everyone. Welcome back to the Hot Flash Health Podcast, where we're dishing out unfiltered truth about menopause with a side of sass and a sprinkle of crass. Get ready to dive into the wild world of hot flashes, mood swings, and all the other joys of being a queenager. This ain't your grandma's podcast. We're here to talk about our bodies, our passions, our fears, our desires, all while navigating that roller coaster ride of menopause. Today, I am your host, Courtney Mamusha, and I'm so excited to introduce our amazing guest for today. So welcome. We are excited to have Dr. Jessica Farahi. Did I say it right?
Yes,
Farahi, like ahi tuna. That's what I keep on saying.
exactly.
Farahi, who is a board certified dermatologist who's not just any skincare expert, she's a skin whisperer. Hailing from Denver, Colorado, with a track record of top notch medical, surgical, and cosmetic dermatology,
That's
Dr.
it.
Farahi has published over 20 jaw dropping articles in leading medical journals, from studying the medicinal power of plants to tackling the most intricate skin concerns. She's the go to guru for that dewy, age defying glow. I can't wait to dive into that. And when she's not making skin dreams come true, she's hiking Colorado trails or cooking up a storm with her family. 3 young kids, I heard. So let's dive in and learn how to love our skin that we're in, because it's time to shine brighter than ever. So, welcome.
Thank you. Thank you so much for having me.
Yes. Well, let's start from the beginning. What sparked your interest in dermatology and led you down this path to becoming a skin guru?
It's a great question. In medical school, you get exposure to a bunch of different fields of medicine, and there are people who are surgically inclined, and then there are people who are medically inclined. And there are a few fields of medicine that marry those two different aspects of medicine. And I really like both of them. I like being hands-on, doing the surgery, but I also like practicing medicine and getting to know patients at a deeper level. So I went into the field of dermatology and was able to do some rotations, and that really solidified my interest in the field. So I've been grateful. And another thing about dermatology that I absolutely love is that the skin is really a window into your inner health, and you can really find out a lot about what's going on inside by looking at what's going on the outside. So that's something that I've really loved exploring. And one last part of it is that I really enjoy giving people the confidence that they deserve to have. And with dermatology, it's just so rewarding. You can have somebody come in with a certain level of confidence, and if you're able to improve the way that they look, then they improve the way that they feel. And I love being able to leave patients with that happiness and joy.
Yeah, I love that too, that you can actually look at somebody on the outside and then tell what's going on the inside, because so many of us are clueless what's going on the inside, right? We don't have a magic 8 ball that
Mhm.
says this is what's happening. And so having that visual cues to really say, okay, you're having acne, or your skin's got rosacea, or whatever might be going on, or it's dry. I mean, we live in Denver, so we know everything is dry. My skin just soaks in the moisture. It's super dry. So tell us a little bit about skin dermatology and what makes it unique, and the kind of experience that patients really want to walk through the door and enjoy.
Absolutely. So, skin dermatology was founded by Dr. Samantha Gazzelli, and it's a female physician-owned practice. We just added a new physician, Dr. Lisa Blackwood, and she's actually starting today. So it's a very exciting time. So that makes three of us dermatologists, Dr. Blackwood, Dr. Gazzelli, and I. And we also have two amazing estheticians who we work with very closely to make sure that we're providing the best level of care to address people's skincare needs. We do cosmetic dermatology, but we also do primarily medical and surgical dermatology. And we see kids, so we see the whole family. So I really like to think about it as like the one-stop shop that you can really address all of your skincare needs. And we don't have to send you here or there. We can really treat you as a whole and personalize your skincare plan.
Yeah. Well, I love Dr. Gazzelli. She's my dermatologist and dear friend. So I'm so excited and proud for you guys to have this new journey and can't wait to come in and have you guys tell me what to do with my face next and body, skin, all, it's not just a face, it's your entire body, right?
We can't wait to
Come
see
on
you.
in. I know, I will, I will. Well, since this is a podcast about perimenopause and menopause, skin and hormones can be quite the duo right now for us, right? Is there anything in particular that women entering perimenopause or menopause need to be aware of when it comes to their skin and how to manage it and how we can tackle it?
Yes, there are so many topics that are related to perimenopause and menopause. In that time period, the estrogen in your body and therefore your skin really declines. And estrogen is an essential part of many skin and hair processes. So when you have reduced estrogen, your skin will become drier and you're more eczema prone. Your hair can become more brittle. It's not going to grow as strongly. Hair loss is another major topic I'm sure we'll talk about today.
Yes.
You can become more prone to conditions like rosacea and other types of sensitive skincare conditions. And as time goes on, people also want to make sure that they're aging gracefully. And so we have all those topics related to how can we look our best at the age that we are. So many different topics, and I'm excited to dive into each one of them.
Yeah, well, let's talk. Let's talk a little bit about cosmetic treatments. I mean, you guys are kind of on the forefront of what's new and what's exciting. What's the lowdown, do you think, on Botox and fillers for those who want a refreshed natural look without the frozen face? Because this is something that we're all talking about. I haven't done any Botox. My partner Dawn has, and she looks at me like, "How have you not done Botox?" And actually, after seeing Dr. Gazzelli, I have like dark circles under my eyes, which never seem to go away. And she had mentioned you could do some Botox down there, which I was like, what? So I think it's a miracle worker. I haven't dived in yet, but let's talk a little bit about Botox fillers and how we can use those to age gracefully.
Absolutely. So those are all kind of in the injectable category, and we have two major categories within it, Botox and then fillers. Botox is basically a substance that we inject into, there are three FDA approved sites and then there are additional areas that they can enhance, but they work to reduce fine lines and wrinkling. And with Botox, as you mentioned, you don't want to have a frozen face. And we oftentimes will advise people that less is more. You still want to have some kind of movement. You just don't want to look as wrinkly and you just want to have a nice refreshed look. The three areas that are FDA approved and the most commonly injected areas for Botox would be the forehead, the glabella, which is between your eyebrows, as well as your crow's feet. And these are areas that can really be enhanced very nicely with the proper injector. There are very few risks involved, and it lasts typically about 2 to 3 months. There are some competitor products, for example, Dysport, and they work very similarly. And we can really look at you and customize the injection points and how often or how much you need based on how you look. The other category of injectables would be the fillers, and fillers have a different area that they would address. So that's more volume loss. So when as you age, or the volume in your skin can go down, and you can also notice certain areas starting to droop and not look as youthful as they used to. And the main thing with this also is you do not want to overfill, because then you have a whole set of other problems. We have all sorts of people coming in trying to get rid of too much filler. The areas that we see changing as people age over time would be you start to lose a lot of volume on your lateral face and your cheeks. And so adding a little bit can help lift up that area. People will start to notice that their nasolabial folds, their areas kind of in the lower face can droop. And so filling in this area can be helpful. Tear troughs can become more prominent. So injecting that areas can brighten your eyes. And then there are the other areas that people like to enhance sometimes, the lips, to give them a little bit more fullness. And one last thing to kind of talk about in the filler world is that there's hyaluronic acid, which can be injected, and that would be fillers like Juvederm or Restylane. And then there's also the biostimulatory collagen building fillers like Sculpture. So those are fillers that take time for you to notice their effects, and they will work over about 2 months. And oftentimes you'll need a couple of treatments to increase collagen production wherever they're injected. So they're more like the fertilizer, if you will.
So how do you kind of look at somebody and say, do you look at them like Botox would be more for like tightening the face and fillers are more for plumpeting? Is that kind of like an easy way to look at it?
Generally, that is true. So with the Botox, if somebody comes in, we ask them, what are you noticing in your skin? And we want to make sure we're addressing that in a very realistic way. So if they're saying, I feel like my skin is very wrinkly, is not as firm, and I'm noticing all these deep set wrinkles in my forehead, then Botox is something that we would probably discuss. If someone's noticing that their face looks more sunken and they want to kind of give it more rejuvenation, more volume, then filler is something we would add. And a lot of times these things go together. And so it's about marrying the two in a very natural looking way. And also it depends on how comfortable the patient is. Some people are more comfortable with one thing and not the other. And we don't want to force people into anything. We want you to feel the best that you possibly can with the products that we have available to us.
Yeah, I think it's a fine line, and like I'm very like I want to be all natural, and obviously want to keep my skin looking the way it is without a lot of invasive products, where some people are getting lip fillers and want to like plump up and change their face and things like that. So I think it depends on your patient and what outcome they're looking for. And I applaud you guys for being that sort of resource for making anybody feel and look beautiful at any age. With us, I'm sticking kind of on the menopause thing, but are there certain things that really happen to the skin that we should be looking at? Like, does our neck get gross? Of course, my daughter's like, your neck's starting to look gross. I'm like, cool, thanks, kid. So, are there certain things that like kind of start to happen that we're like, oh, this is like, I'm noticing this, like drier skin, or a couple things we should keep an eye out for?
Absolutely. So the more we use our muscles, the more the wrinkling becomes observed, because basically the more you contract your muscles, you'll start to notice those muscles, like for example in your forehead you have a frontalis muscle. The more it's contracted, the more expressive you are, you'll notice that those lines start to settle. So that's one thing. You mentioned the dry skin. That absolutely happens as we age, because the amount of estrogen and the collagen in our skin starts to go down. And also, we've experienced more sun damage, and sun damage can thin your skin out and also make it more susceptible to concerns like hyperpigmentation and then also fine lines and wrinkles. So, those kinds of things can happen just with going outside in beautiful Colorado and just experiencing what Denver has to offer. So, all of those things kind of you see more at a higher rate in perimenopause and menopause.
Yeah. Well, just one more thing we all get to look forward to, which is fun.
Well, there's
Means
a
we're
lot
living
you
life.
can do. Yes,
Yes.
absolutely.
There is a lot we can do. I know. That's why I love having secret weapons like you guys over there at Skin Dermatology who can partner with us for perfection, right?
Yes. And some of it's not also secret. I think, the point of making sure you're protecting yourself from the sun has probably been belabored and you hear it all the time, but it really is something that is a go to. Wearing your sun protection, wearing your sunscreen, just that alone can help your
Yeah.
skin out so much. A lot of the damage has been done, but there's so much to do moving forward. And when we look at sunscreens that are designed for more mature skin, they oftentimes will have added ingredients to help repair sun damage. For example, there's a brand Istin or Elastin in their actual sunscreens. You're not just protecting your skin from the sun. They have reparative enzymes. Elastin has their trihex technology that improves elastin production, so it helps with the skin integrity. Istin will have their DNA reparasomes in their sunscreen. So there's a lot you can do just with basic skincare to protect your skin and keep it fresh moving forward.
Yeah, I know. It's like long are the days. I remember my mom would bask in the sun with baby oil, and I'm sure I did that early as a teen, and now, I've got a teenager myself, and I'm like, put the white stuff on, like, don't go out. Like, she's got fair skin like I do, so I'm like, you're screwed. And of course, my husband's Italian, so he's like the dark, beautiful olive skin. I'm like, no, you need to put stuff on, your cheeks are red. So it's hard to protect ourselves from that sun that is beating down on us daily, right?
Everywhere, yes.
Yeah. Well, we talked a little bit about hair. I think that's another big issue that we have as we are aging, is that all of a sudden our hair starts falling out. So hair today, gone tomorrow, right? Fun. What do our luscious locks seem to pull? Like, why do they pull a vanishing act as we age? And what can we do to help keep that volume up?
There are several different types of hair loss that can occur in perimenopause and menopause. So they're not all the same. I would say the two broader categories would be scarring hair loss, so more permanent hair loss, as well as the non-scarring hair loss, which is the more common type of hair loss. In terms of the scarring hair loss, there are actually conditions and pathologies that occur when our estrogen starts to decline. For example, there's a whole entity called frontal fibrosing alopecia. And this is something that has a diagnosis that has been more recently coined, where you start to see the hairline starting to recede and scarring starting to happen. And so this is a progressive process that we need to get ahead of so that we can prevent it from marching backwards. You'll also start to notice people losing the size of their eyebrows and other hair on the body and things like that.
Why don't we lose it anywhere we need to lose it? That's
I
what I want
know,
to know. 'Cause it starts
I
to
know.
grow places that we don't need it, and we're losing it. It's like so funny to me. I'm like, where did this hair come from, and why isn't it gone everywhere I want it to be gone?
No, I wish we could just redistribute.
Yeah.
And so that's one type of hair loss that we see a lot of. And then there's the other type of hair loss that a lot of people kind of know about, which is the male pattern hair loss, where you start to notice a little bit of a widening part. And that's not necessarily scarring, and we can do a lot about it, but it's a matter of catching it and making sure that you're on top of it. You're doing gentle hair care practices, you're not overly processing your hair. You're treating it well with respect. But then there's also treatments that we can use, for example, minoxidil, which is Rogaine. At men's strength, it's highly effective. A little bit every night can go a long way, and you can really start to see regrowth. And a big part of hair loss also in the non-scarring category would be nutrition. We
Mhm.
want to make sure that we're fueling ourselves properly. You need nutrients for your hair to grow. Your hair is not going to grow if the rest of your body is stressed out. Your body's trying to preserve those resources to take care of you. And so your hair is not always going to be the priority if you're not giving enough to the rest of yourself. So I always say that if you're noticing more hair loss than normal, it's really important to dive into what could potentially be contributing to it and making sure that you address all of those processes, making sure you have all of your nutrients, your iron levels are normal, your hormone levels are regulated. All of those factors really influence your hair growth and hair strength.
Yeah, I mean, then that brings a good point too, and kind of what we talked about earlier of knowing your body inside and out. And I know you're not a nutritionist, but obviously you have some thoughts. Like, what do you recommend that people really do to help with their skin and hair maintenance? Does it take vitamins? Does it look for leafy vegetables? I mean, do you have any kind of quick tips that you recommend to people to feeling good inside out?
Absolutely. Yeah. So it's very important to have a well-balanced diet. So when somebody comes in, we like to know, are they missing any food groups? So for example, if you're a vegetarian and you're not consuming meat, sometimes you can be
Iron.
vitamin B12 deficient, iron deficient, and all of those can play a role in how your hair grows. But I'm not necessarily just going to generalize and say eat this specific diet. So it's
Yeah,
helpful to get lab work in that scenario.
yeah,
I've also had vegetarians come in, and since they know that they're vegetarians, they're taking all of these supplements. And actually, that can also negatively impact their hair growth because now they're iron overloaded. I just had a patient recently who I had to say, stop the
stop.
iron. Your body is actually has too much iron, and that can also be stressful to your body. So it's very important to take an individualized approach and make sure that you're finding out what someone's regular diet is and making sure that they're getting all of their fruits, vegetables, protein, everything is kind
Everything.
of whole in that
Yeah.
diet.
I'm sure you're helping your three kids. You've got three small kids at home, so I'm like, I can imagine you're like, here's your fruits, here's your vegetables. I mean, those who are chewing food right now for sure. So it is hard, and I don't know why. I was just thinking about, when we get sick, and I was born jaundice, so again, like looking at the cues on inside your body that can really help tell outside what's happening too. So I would say, echo what Dr. Farahi is saying is get the blood work done. And luckily here, sorry to shameless plug, but at Hot Flash Health, we offer in-home testing. So you can just order it on our website and get your blood work done and not even leave your home. So I do express that and do it more frequently, right? Because I just had blood work done and my liver doesn't look great because I just had heart surgery. So, I'm just sort of like nervous about that. And I'm like, okay, I want to like change some things about my diet and take supplements and then see where I'm at in another 3 months. So I would say like it's really important to know what's going on inside and out.
I absolutely agree with that.
Yeah. We'll go back to the world of dermatology. Sorry, going off on a rant.
Well, it's all
Any,
interrelated. So
that's true.
we will often send people with lab orders to get their blood work done because it's
Yeah.
such an essential part of figuring out what's going on. So
And that
definitely
kind of
related.
and that takes like your medical interest with the skin interest, right? And that's marrying that up to
Absolutely.
have more. And I think doctors practices are becoming wiser and having this more holistic approach to medicine in general, where they're not just, okay, I'm a skin doctor and this is all I'm going to treat, but you yourself have had the history of understanding the medical practice and the dermatology and how to marry that together. So I really applaud that, and I'm excited to
Appreciate
come see you guys.
to see you.
Are there any jaw-dropping, cutting-edge treatments that we should know about? And I just had brunch with a girlfriend of mine, and she says she does this laser treatment or something once every year, and she can't go out in public for like a week, but it takes like 10 years off her face. And I was like, okay, tell me more about this. So I don't know if that's something you guys do or even know what it is, but give us spill the tea on what's new.
Absolutely. So there are so many different things. There are lasers, and then there are other kind of skin tightening devices, for example, radio frequency. So we have estheticians at our practice who do those treatments, and they are just jaw dropping, as you explained, and maybe not right away. So there is a little bit of downtime, but it's not like going and getting a facelift. It's
Yeah.
non-surgical. The radio frequency devices, for example, we have something called the Opus. Some people have heard about the Morpheus, for example. You get the procedure done, and then for about a week or so, maybe your skin doesn't look ideal, but you're
Ideal.
still able to go out there.
Yeah.
We do it and then see our patients the very next day. You can put a little bit of cover up on it. And a couple weeks later, you really start to notice your skin is glowing, the fine lines have been addressed, they're softening, and you can really build that up and, maybe have 2 or 3 treatments, and maybe for some people it'll erase 10 years, but at the very least, it'll just make you feel more confident. Your makeup will be applied more smoothly, and you'll look more refreshed over time.
Yeah, I mean, I think I know, like I noticed that too, and I don't do a really great job of taking care of my skin. I'm trying to as I'm aging, but I do know, and I heard, and maybe you have some guidance around this of like getting a facial. I don't know if it's like every month to really help exfoliate the dead skin, or just use an exfoliator at home. But do you have any kind of practice tips that people can use at home to like make sure that they're getting rid of all the dead shit and making sure we're
Yeah.
soaking in the good stuff?
As you were talking, my head was immediately going to using a retinol or retinoid, which
Okay.
a lot of people have now heard about. They come in asking for these products. Basically, your skin, as you age, fine lines and wrinkles, collagen goes down. And the way that you can really build that up slowly over time would be to add a retinoid product over time. So this will help with skin cell turnover as well as the collagen production, helps remove sun damaged skin, helps with hyperpigmentation. And basically, there are over the counter, less aggressive treatments. And then there are prescription strength treatments. And it's really important to understand your skin. You don't necessarily want to use the strongest product out there. So it's helpful to speak with a dermatologist to kind of assess where you're at and how much you can tolerate. We're in Colorado. I am definitely not going to prescribe a prescription strength extra potent product for everyone. And it's really important to, if you are using a new product, integrate it slowly, couple nights a week. Make sure you're moisturizing your skin as well. Because what can happen if you overdo it is your skin will become red and peely. You're going to have to figure out a way to get it back to baseline. You're going to stop using the product and then it's going to stop working. So figuring out a good plan of how you can get that into your skincare routine is essential.
Yeah, I agree. Well, good to know. Well, looking at kind of where skincare is heading, I know everything is changing on a daily basis and there's new, tools that you guys are using. I see things all on Facebook about that like thing that you put all over your face, and I see all these famous people with that red mask on. I don't even know what's happening, but I'm like, maybe I need one for Christmas. Like, where do you see the skincare industry heading? What trends should we be hopping on, know about? What's becoming the it thing right now?
Since this is a perimenopause and menopause
Yes.
podcast, I think one topic that's super hot in that world is using vaginal estrogen on your skin. And I haven't had so many people ask about it in Denver, but I know that it's a hot topic. I speak to a bunch of my colleagues in different states, especially on the East Coast and West Coast, where people are really trying to get ahead of the trends.
Yeah.
And vaginal estrogen that literally OB-GYNs prescribe for vaginal dryness can be used for dryness and those reductions in estrogen in facial
On your
skin.
face.
But I would say you also want to be very careful for that. So it can be irritating if you overdo it. And one more thing is that if you are hyperpigmentation prone, conditions like melasma, which occur usually earlier than menopause, you'll actually notice those things improving in menopause because they're really estrogen driven. But anyway, if you have those predispositions to having darkening of the skin, you really want to be careful with estrogen on the face because estrogen will promote darkening of the skin in that situation. So you have to make sure you're assessed properly before you go ahead and use it. And you want to use it slowly. So the creams, I would put it on like a small area first to see how you do.
Yeah.
And I wouldn't say it's your only tool in your skincare arsenal, but combining it with something like a retinoid every couple of nights can be really helpful in turning back the clock a little bit and giving your skin that estrogen that it's missing.
Well, that's good to know. I
Yeah.
mean, I guess can lube up many things, and you can put
Yeah.
that
Yeah.
vaginal estrogen on your face. Who knew? Who knew it? We kind of talked, like you just talked a little bit about hyperpigmentation. We've talked about rosacea, some other kind of concerns with the skin. What's your go-to advice for managing those tricky skin issues moving forward? How do we tackle this?
Absolutely. So lots of different questions in that one question because
Yes.
they're all such different processes. In terms of hyperpigmentation, the number one thing to know is that your sun protection is the most important thing. And so if you have sunspots, your sunspots will get darker with sun exposure. And wearing a tinted sunscreen is especially helpful because the tinted sunscreen will have iron oxide in it. So it's not just about giving you that coverage with the tint, it's also about protecting against darkening with the tint. And you really want to make sure that you're reapplying your sunscreen. So sunscreen's good for about 2 to 3 hours. And then things like hats can be helpful, sun protective clothing as well. There's a bunch of different medical treatment options, procedural options to treat hyperpigmentation as well. But that's kind of the overall answer to the hyperpigmentation question. In terms of rosacea, now we're dealing with sensitive skin type. There is a genetic predisposition for people to have that condition. And what you also want to understand with that is it happens later in life as the collagen in your skin starts to go down and your skin starts to thin. So you start to see more prominent blood vessels. And so sun protection is essential for that as well, because if your skin is getting sun damage, it's going to further thin out and those blood vessels will become more prominent. And there are lots of different treatment options for rosacea as well, to help reduce redness, to help reduce any kind of acne that can occur with rosacea. A lot of people think that they're getting acne when they're actually getting rosacea because there is a type of rosacea that's an acne type of rosacea.
Mm.
So it can really be treated with a lot of different topical prescriptions. And then with rosacea, it's also important for you to understand you. So there are different triggers for rosacea, and some triggers are pretty universal. Sun exposure will make your skin flare up. Heat, even like people are obsessed with saunas and making sure that they're getting enough heat rate, to feel good in their skin. but that can actually flare up rosacea.
Mm.
And then there are individual triggers. For example, some people will flare up when they drink alcohol, drink caffeine, have chocolate, all the fun stuff. If you're noticing that those things are bringing your rosacea out more, if you can reduce your exposures to them, it will help your skin reduce an inflammation and
Yeah,
redness.
that's a lot. I mean, I feel sorry for people who have rosacea because it's like you genetically inherited, and it sounds like it's a very sensitive thing, and you don't know what's gonna react with your skin. Speaking of like me going through perimenopause right now, I'll wake up and have like pimples on my face, and this is all like new to me. Is it, I know our hormones are changing and things are, it's kind of like we're going back to our teenager years. This is why we've coined queenagers, because we're no longer teenagers, we're queenagers. We've perfected everything. But as speaking of like adult acne and kind of how do we manage this as women who are starting to go through perimenopause and menopause and make sure that we're not feeling like our hidden teenage selves again?
Absolutely. There are so many reasons for acne in this category. One would be people start to use all sorts of skincare products, and sometimes they don't cooperate with your skin so well, and they can be comedogenic, meaning that they can actually clog pores and lead to the progression of acne. And so, with that, I would say less is more. You don't want to pile oil on top of oil on top of oil on top of oil. Yes, your skin is dry, but you don't need to pour oil on it. And you also want to make sure that your products are not clogging your pores and that you're rinsing them off at the end of the night and that they're not just sitting on your face and caking up. Another reason for acne would be hormonal fluctuations, and there's a lot we can do about that. There's topical treatment regimens, and there are also pills that you can take to help reduce those. Another category that I'm starting to see a lot more of in practice is acne that's actually driven by hormone replacement therapy. So sometimes, if the ratios are not correct, and for example, if you're in a high testosterone state, you're taking too much testosterone, that actually can promote acne as well. And, all of these things are treatable, but I'd rather take away something that's potentially triggering acne than keep adding and adding medications and complicating the issue. So it's really important in that scenario to check in as well and get your labs monitored and make sure that your hormones are regulated and that you're treating the underlying cause of the acne.
Yeah. Good to know. Good to see. It all starts from the inside out. I think that's like the message we're taking away with this. There's so many myths about skincare, right? Like, what's one myth that you'd really like to banish from the world of skincare that you roll your eyes and you're like, oh,
I think the biggest myth is that skincare has to be complicated. And I'd really like to address that. I think that if you're going to delve into the topic of skincare and try to take care of your skin, often, in most cases, less is more. So maybe do one thing in the morning in terms of an active, and maybe do one thing at night in terms of an active, but I wouldn't go ahead and do multiple steps at a time, especially if you haven't given the one or two products a chance to work. Sometimes your reactions to products can be delayed. So you could be using them for weeks and you'll be like, oh, I'm totally fine. I'm just going to add something else. And then you reach a crash point where your skin is just freaking out. We don't know what it is. So I would say do it slowly. You don't want to do 100 products at once. And if you have a bag of products, which most people
most of
do
us
coming
do.
into dermatologists,
Right.
we need to go through that bag. We need to limit what you're doing and figure out a plan for you to use these products in the most efficient way.
That's good to know too, because again, finding a partner in any sort of medical profession is so highly valued. And having you guys that could say, hey, yeah, bring in your whole makeup bag, your skincare bag, let's look at what you're doing and kind of help weed through that. Because all of us women, let's face it, are buying like the next best thing. And we're like, oh, we saw this and we looked at this, and Instagram and TikTok are feeding us this. This must be the it thing. So we have bags full of stuff and don't even know how to use it. I mean, speaking of that, right? You're a professional. I'm sure you have your own favorite products, but can you kind of give us some of your favorite finds out there? What are your, tips or products that you really recommend to people?
Absolutely. So, number one, most important thing, sunscreen. I think it's
Sunscreen.
so essential to find a sunscreen that you like to put on your skin. And if you have to splurge a little bit, then do it for your face because you really have to feel confident with that sunscreen. You don't want it to be the wrong color for your face. You don't want it to be too cakey or thick. You really want it to be smooth on your skin. My favorite brand for that would be, I have two favorites actually. Istin makes their Erfotona Ageless. It's a liquid that just goes on your skin and blends right in. They have a tinted one, which is my personal favorite, and it has those DNA repairasomes in it, so it can provide you the skincare and the sun protection. Elastin also is a fan favorite. It's very hydrating, nice and moisturizing. That's also a tint. They have a Hydro Tint one that's fantastic. And then in terms of two other products that I would recommend if you're starting out on your skincare journey, one would be a vitamin C product in the morning. The original one, fan favorite, one that I've been using for years would be the SkinCeuticals vitamin C. They have a couple different types depending on your skin type. Elastin also has a fantastic C radical defense vitamin C serum that is chock full of different antioxidants, helps repair sun damage, and protects you from environmental toxins. And there are lower price points. I just discovered a brand called May Love, and they have a fantastic glow maker vitamin C serum as well. And I've actually been using that one and really enjoying it. And then at night, the retinoid product, there are prescription strength. And so looking at your skin type, I would figure out which strength would be appropriate for your skin type if you're at that level even. And then there's a brand called Skin Better that I absolutely love because they have created a alpha-ret, which is a retinoid that is tolerable by practically anyone. So that's a product that I recommend for anyone who wants to use a retinol product, who is afraid of having the skin sensitivity. They've actually done studies comparing that product to prescription strength tretinoin,
Oh,
and they work just as well. So those are kind of my favorite
that's great.
skincare products to start with.
I love it. Well, I need to. We'll put a list in the podcast. We always kind of
Sounds
do
good.
the top things. But thank you so much. Before we go, because I don't really want to end this, but we all have kids to go take care of, business to go run. Where can our listeners find you guys in person and follow you? And what? How can we all stay in touch with the great things you're doing to keep us looking youthful and beautiful at any age?
Well, thank you. And thank you for having me.
Yes.
So, we have a couple different ways that you can find us. In terms of skin dermatology, it's SKN Dermatology. There's no I in there. We have a website with online booking and lots of information on there, blog posts, so you can find a lot about different topics. And it's really easy to make an appointment. So, skndermatology.com. We have an Instagram page, and on that Instagram page, lots of great skincare tips from all of us, the entire team. And then I have my own Instagram account, try to keep things interesting on there as well. And it's Dr. Jess, Jess Farahi, Farahi. So give me a follow on there. I'd be happy to see you. And we also have emails that we send out every so often, giving you instructions on how to take care of your skin with different seasons, all different age groups. And we also have tons of different promotions and things happening in the office that we can keep you in touch with through those emails.
We love it. Well, thank you, Dr. Jessica Farahi, for being here. We would love to have you back again. Let's keep the communication lines open because I'm sure our listeners will have other questions that we can dive into. So thank you for your time today.
Thank you so much. And if you ever have any questions, you can always leave them on my Instagram page, and I'm happy to answer any of them. I'd love to come back as well. Thank you so much for having
Yeah.
me.
Perfect. Well, I will say that's a wrap for today's episode. Remember, menopause may be a wild ride, but together we've got this. Don't forget to follow us on Facebook, Instagram at Hot Flash Health. Stream and subscribe to us on any of your podcast channels. We are there at Hot Flash Health. And share your thoughts with us and questions. Like I said, we are happy to hear them and have guests back and share anything that you guys want to dive into. Until next time, keep those hot flashes in check, y'all.